The roller coaster of COVID-19 cases seems to have hit a plateau in the United States. New daily infections are holding steady at around 70,000 after dropping sharply several weeks ago. More than 12,000 people are dying each day. Hendrik Sabrandi reports on one state that is seeing a surge.
For most of the pandemic, Colorado has lagged behind other states in COVID-19 case rates. But things have changed.
Things are tight in Colorado. In many areas of the state. We're experiencing a peak right now that many other areas of the country experienced a month or two ago. We're down to less than 100 emergency beds across our state.
Colorado, according to several surveys, now has the third highest case rate in the country, and hospitalizations continue to climb here, topping 1,400 total.
You feel like we're getting through it and we're moving on, and then it just so quickly escalates again.
Kara Welch is with the Colorado Hospital Association, which reports acute care beds in hospitals are at 90% capacity. Far from all patients are battling COVID.
We're seeing a lot of people coming in very sick. We believe maybe some of those were people who delayed care earlier in the pandemic.
That's just one reason for the packed hospitals. Colder weather has also driven people indoors, increasing the risk of infection. In a way, Colorado may also be a victim of its own success.
We did a really good job early on of getting a lot of people vaccinated. So there's some theory or some wondering if it's possible that some of that immunity is waning faster in Colorado.
Experts say the Delta variant has done a good job of finding those who've refused vaccines.
We continue to see the impact of the unvaccinated on our hospitals, and 80% of those who are currently hospitalized in Colorado are unvaccinated.
Colorado hopes booster shots and the opening up of vaccines to 5 to 11-year-olds will help, along with monoclonal antibodies, a COVID-19 treatment that could keep people out of the hospital. The state has now given medical facilities more flexibility in how they employ their staff. A federal team has also arrived to help. But Colorado's governor says 300 to 500 additional hospital beds may yet be needed.
So I think there's still an expectation by the experts in Colorado that our cases will continue to climb through the end of this year, which is incredibly concerning.
Holiday family gatherings could well contribute to this surge, which at the moment shows no signs of abating. Hendrik Sabrandi, CGTN, Denver.